Dr. Darien back again with us now. The question that one of you are asking, here it is. When should I be concerned about bulging veins in my legs?
You know, this is quite a common problem. An estimated 30% of people, even more, have this symptom, which is called varicose veins. And that's when the vein gets tampered with or harmed in one way that causes it to bulge out. Most often, it is not a concern. It is not a medical emergency. But if you had pain, redness, or any sign of an infection, that's when it can become a problem. And for getting these treated, if you don't want it, this is a procedure where you would seek out a vascular surgeon. The procedure is often an outpatient or office procedure with minimal to no discomfort, and you can walk out of there the same day without any harm. So I think it's one of those things that you can have a conversation about, especially if you have symptoms.
Yeah, then might as well get it checked if
Absolutely. A lot of people are always concerned also, could it be a blood clot? And most often these types of veins are superficial or close to the surface of the skin. So even if there was the possibility of that, that's not a concern. What we look for as doctors are those deep blood clots. That's what causes harm.
Got it. And your prescription for wellness today?
It's about heel spurs. And so something that we talk about a lot, especially for runners, for people who are active, heel spurs. It can happen, unfortunately, at the calcaneus, which is the name of your bone. It can develop new bone that causes more pain. And most common cause is plantar fasciitis. So some things that you can do to help prevent that: number one, treating the pain. If you freeze a water bottle, for example, and you just roll your foot over it, that can often alleviate a lot of that pain. Of course, thinking about things like NSAIDs or Tylenol for pain. And then also stretching is really, really important. And it's something you can do just sitting down. You can just grab your front of your toes and pull them back, and that's what you're going to stretch that plantar fasciitis, or fascia. And that's, you want to hold that for about 20 seconds and do that about 3 times a day. Anyone and everyone can do it. If you have difficulty reaching down, you can use a towel. But again, stretching, treating the pain immediately, using ice is probably the most obvious thing that you should do at first.
Dr. Darien, thank you so much as always, and we'd love to hear from you. So hit us up on Instagram with all your medical questions at ABCGMA3.